this one was also surprising to me. I did not know omega-3s help decrease the risk of glaucoma. I mean, I love omega-3s, in food sources, and supplements too, but we're going to stick to whole foods. But especially for dry eye, because that's a big passion of mine, but I did not know that it would help glaucoma, but it does. Eating more omega-3s is thought to help decrease your risk of glaucoma. Eating vitamin B3 is thought to decrease your risk of glaucoma as well. So things that have vitamin B3, I've got this little chart on the right side: peanuts, avocados, mushrooms, brown rice, and green peas. These are all good for your eyes. I'm sure you'll love them anyway. And higher doses of antioxidants were associated with a decreased risk of glaucoma, specifically vitamin A, C, E, zinc, selenium, and magnesium, which is so cool. So as you're eating healthy, you're decreasing your risk of glaucoma as well. Okay, specific foods for sometimes increasing risk. Coffee, sometimes thought to increase your eye pressure by increasing the fluid production, and possibly with some dehydration. Some association in multiple studies with worse glaucoma, but not like a causation. Tea, however, was thought to be protective by reducing the oxidative stress with flavonoids, at least 1 cup of tea per day, which is interesting. So if you're into coffee or tea, tea is better than coffee for glaucoma. Dark chocolate was thought to help decrease the oxidative stress in normal patients. And then it helps produce nitric oxide, which is NO abbreviated, which can also help kind of open up those blood vessels and help protect against glaucoma. Just so interesting. And of course, nitric oxide can help with heart disease and peripheral artery disease. So not too much, a little bit, as you know. Specific foods and glaucoma. This is interesting because patients sometimes want to take supplements for glaucoma, and of course, we want to focus on whole food, plant-based. Ginkgo biloba is a supplement that's kind of thrown around for glaucoma. I don't really support it. I don't tell my patients to take it, but there is some studies showing that it increases blood flow and helps protect against it. You definitely cannot take it raw. It does have risk of bleeding disorders. It has risk to your heart as well. So please don't take supplements with ginkgo without talking to your doctor. One study actually showed saffron can lower your IOP as well, and vitamin C can help decrease your risk of developing glaucoma. I've got another diagram on the right showing foods rich in vitamin C, which you all know. There's gooseberry, amla, oranges, bell peppers, cantaloupe, kiwi. One missing on this chart is strawberries, which have a good amount of vitamin C too.